What causes bad breath? The signs of bad breath are detectable by others even before the person who is experiencing it. If you've ever gotten that not-so-fresh feeling on a date, at a job interview or just talking with friends, you're not alone. Your close ones may also tell you about the symptoms of bad breath. The unpleasant odor is unbearable to stand, making the person uncomfortable, causing anxiety. Studies show that 50% of adults have had bad breath, or halitosis, at some point in their lives. Certain body odors are common, but they are generally mild and temporary. Many foods can taint your breath immediately after a meal. Garlic and onion can actually stay on your breath for 24 hours or more. Active chemical travels through the digestive tract to the blood to the lungs and back out through the mouth. Smoking and drinking also leave their distinctive mark on the breath. Even dieters may develop a mildly unpleasant hunger breath when certain metabolic wastes reach the lungs. While dieting, your body breaks down body fat. This releases chemicals that can give your breath an unpleasant smell. Then there is morning breath. While you sleep, your tongue moves less and secretion of saliva slows down almost to a standstill. Dead cells that are continually shed from the tissues lining your mouth are not rubbed off, washed away or swallowed. Bacteria in the mouth break down those dead cells, releasing malodorous byproducts. But the odor disappears as soon as you brush and floss your teeth. There are lots of myths about taking care of bad breath. Here are 3 things you may have heard about bad breath that are not true. Myth number 1: mouthwash will make bad breath go away. Mouthwash only gets rid of bad breath temporarily. If you'd use mouthwash, look for an antiseptic, kills the germs that cause bad breath, and plaque-reducing one. Myth number 2: as long as you brush your teeth, you shouldn't have bad breath. The truth is that most people only brush their teeth for 30 to 45 seconds, which just doesn't cut it. To sufficiently clean all the surfaces of your teeth, you should brush for at least 2 minutes at least twice a day. Remember to brush your tongue, too. Bacteria love to hang out there. It's equally important to floss because brushing alone won't remove harmful plaque and food particles stuck. Myth number 3: if you breathe into your hand, you'll know when you have bad breath. Bad breath? Wrong. When you breathe, you don't use your throat the same way you do when you talk. When you talk, you tend to bring out the odors from the back of your mouth, where bad breath originates. Also, because we tend to get used to our own smells, it's hard for a person to tell if he or she has bad breath. If you're concerned about bad breath, make sure you're taking care of your teeth and mouth properly. Some sugar-free gums and mints can temporarily mask odors, too. Chronic bad breath, which is sometimes called halitosis, is often a sign of poor dental hygiene or dry mouth. The condition may also be a sign of a more serious mouth disease or an illness in another part of your body. It includes gastric reflux, diabetes, kidney disease and liver disease. What are the causes and symptoms of bad breath? 1. Poor hygiene. This is the most common cause of bad breath. When food particles are stuck between your teeth and your mouth, they get broken down by bacteria that grow there. That process releases a foul smell. The bacteria can also cause tooth decay and gum disease. Brushing your teeth and tongue and flossing help to remove the food residue and control the bacteria. 2. Dry mouth. Saliva helps to wash your mouth, so if your body isn't making enough saliva, your breath can smell bad. Smoking can cause dry mouth and also increases the possibility of gum disease. Certain medications can cause your mouth to be dry. 3. Tobacco products. Smoking causes its own unpleasant mouth odor. Smokers and oral tobacco users are also more likely to have gum disease, another source of bad breath. 4. Infections in your mouth. Bad breath can be caused by surgical wounds after oral surgery, such as tooth removal. It may be also due to tooth decay, gum disease or mouth sores. 5. Medications. Some medications can indirectly produce bad breath by contributing to dry mouth. Some other medicines can be broken down in the body to release chemicals that can be carried on your breath. 6. Cancer in your mouth, or between your nose and your mouth, or a pharyngeal cancer. It may cause sores that don't heal, mouth pain, difficulty swallowing, a lump in your neck and unexplained weight loss. 7. Gastroesophageal reflux disease, GERD. This is a digestive disorder. The stomach acid or fluids leak back into the esophagus, the tube that takes food from your mouth to the stomach. Onion, garlic, alcohol, coffee, fast food, chocolates should be consumed in limited portion, as it can trigger acid reflux. Tonsil stones. 8. Tonsil stones. Food gets stuck in your tonsils, which are at the back of your mouth on both sides. It sometimes hardens into calcium deposits called tonsil stones or tonsilloliths. 9. Gum disease. Gingivitis is an inflammation of the gums that can cause them to be red, swollen and bleeds easily. It is caused by plaque, a sticky film that builds on your teeth and can be removed by brushing and flossing. Trench mouth is an advanced form of gingivitis that can involve intense pain, bleeding, fever and fatigue. It's called trench mouth because it was a common illness for soldiers in the trenches during World War I. Untreated gingivitis can lead to periodontitis, which damages gum tissue. It can lead to tooth and bone loss around the teeth. 10. Infections in the nose, throat or lungs. Patients with pneumonia, for example, cough up liquid that smells bad. 11. Diabetes. People with diabetes have an increased risk of gum disease. And gum disease can make it harder to control diabetes because it can increase blood sugar. 12. Liver disease or kidney disease. These can lead to bad breath because of the smell of toxic substances. They are normally filtered out of your body by properly functioning kidneys or liver. 13. Sjögren's syndrome. This is an autoimmune disease that can lead to dry mouth, dry eyes and dry skin, as well as muscle pain. Rare causes of bad breath include 14. Ketoacidosis. When the insulin levels of a person with diabetes are very low, their bodies can no longer use sugar. They begin to use body's fat storage instead. When fat is broken down, ketones are produced and build up. Ketones can be poisonous when found in large numbers and produce a distinctive and unpleasant breath odor. Ketoacidosis is a serious and potentially life-threatening condition. 15. Bowel obstruction. Breath can smell like feces if there has been a prolonged period of vomiting, especially if a bowel obstruction is present. 16. Bronchiectasis. This is a long-term condition in which airways become wider than normal, allowing for a buildup of mucus that leads to bad breath. 17. Aspiration pneumonia, a swelling or infection in the lungs or airways due to inhaling vomit, saliva, food, or liquids. Bad breath can be reduced or prevented if you practice good oral hygiene. Fluoride toothpaste. Brush twice a day with fluoride toothpaste to remove food debris and plaque. Brush teeth after you eat. Keep a toothbrush at work or school to brush after lunch. Don't forget to brush the tongue too, or use a tongue scraper. Bacteria on your tongue can contribute to bad breath. If you can't brush after a meal, give your mouth a good rinse with water to at least loosen up and free those trapped bits. Replace your toothbrush every 2 to 3 months or after an illness. Use floss or an interdental cleaner to remove food particles and plaque between teeth once a day. Rinse with an antibacterial mouthwash twice a day. Antiseptic mouthwash can help kill bacteria that cause bad breath and plaque that can lead to gingivitis. Adding a fluoride rinse to your daily routine can help prevent tooth decay. Dentures should be removed at night and cleaned thoroughly before being placed in your mouth the next morning. Clean braces and retainers as directed by your dentist. Boost the production of saliva by using sugar-free chewing gum, sucking on sugar-free candy. Saliva can be generated by eating healthy foods that require a lot of chewing. Consuming plenty of water at regular intervals produces enough saliva in the mouth, leaving no scope for dry mouth. Your dentist might recommend or prescribe products that can produce artificial saliva or help your body produce saliva. See your dentist regularly, at least twice a year. They will do an oral exam and professional teeth cleaning and will be able to find and treat the cause of bad breath. Stop smoking and chewing tobacco-based products. Ask your dentist for tips on kicking the habit. Drink lots of water. This will keep your mouth moist. Gums and mints containing xylitol are best. Eat more fruits and vegetables and less meat. Apples, Carrots, celery, and other hard fruits and vegetables help clear odor-causing plaque and food particles. Home remedies for bad breath. Bad breath can be easily treated with a little caution and adding some home remedies to your regular dental regime. Here are some simple home remedies ready to wash away your bad breath. Natural herbs and spices like fennel seeds, cinnamon, cloves, parsley, basil, and peppermint are aromatic. Spices and herbs. Chewing these spices and herbs post-lunch or post-dinner in limited amount prevents bad breath. Using mustard oil with a pinch of salt for cleaning your teeth is a useful home remedy against the cavities or plaque. Mustard oil contains antimicrobial property that destroys the bacteria formation on the gums, making the gums stronger. Chewing basil leaves or infusing it in your tea is an effective home remedy for treating bad breath. Basil is a leafy green that has an added advantage of being packed with chlorophyll. Chlorophyll is a natural deodorizer that eliminates foul smell from the mouth and also aids digestion. Chew a small piece of lemon for a fresh burst of citric flavor. The citric acid stimulates the salivary glands and fights bad breath. Apple cider vinegar consists of natural acetic acid. So, a vinegar mouthwash can cease the growth of germs and bacteria due to its acidic property. Add 2 teaspoons of white or apple cider vinegar to 1 cup of warm water. Clean your mouth with this solution for at least 30 seconds and see the results. These useful home remedies are usually safe to consume. What is the best technique for brushing teeth? Use a soft toothbrush of a size and shape that allows you to reach all areas of your mouth. Hold the brush at a 45-degree angle to the gums and use short strokes, about the width of a tooth. Make sure you get to the outside, inside and top of each tooth. Don't press down hard on the brush. That is hard on your gums, and the brush won't work as well if the bristles are flattened against your teeth. What is the best technique for flossing? Break off about 18 inches of floss and wrap it around your middle fingers. Use your thumbs and forefingers to hold the floss tightly so there is an inch or 2 of it between your fingers. Guide that middle section between teeth and rub gently, wrapping it around the sides of your teeth. Diagnosis: often, a dentist will simply smell the breath of a person with suspected halitosis. He would rate the odor on a 6-point intensity scale. The dentist may scrape the back of the tongue and smell the scrapings, as this area can often be a source of the aroma. There are a variety of sophisticated detectors that can rate odor more precisely. Halometer: this detects low levels of sulfur. Gas chromatography: this test measures 3 volatile sulfur compounds, hydrogen sulfide, methyl mercaptan, and dimethyl sulfide. Beta test: this measures levels of a specific enzyme produced by halitosis causing bacteria. Beta-galactosidase test: levels of the enzyme beta-galactosidase have been found to correlate with mouth odor.